This is my video reflection on mental health and substance use disorder, especially the content that we've gone over this week. To begin, I'd like to say mental health is something that is incredibly important and relevant to me personally and in my nursing career. I currently work in a pediatric medical surgical unit where up to 9 out of the 26 patients on my floor have been admitted for psychiatric reasons, most commonly an intentional ingestion, such as of Tylenol, as a suicide attempt. This has surely gotten worse since the development of COVID-19, as well as an increased use in social media, I believe. This crisis has even been shown by the American Academy of Pediatrics declaring a state of emergency in pediatric and adolescent mental health. So this is something that our country and healthcare providers' attention is really needed on immediately. So what I have learned about mental disorders from this course, I have learned just how common mental disorders really are, specifically depression, with up to 20% of women and 10% of men having depression. I also learned that schizophrenia can be caused by a viral infection during pregnancy or by some kind of perinatal complication. This was something I was unaware of. I knew that genetics played a role, but I did not know that an infection during pregnancy can increase the risk of the baby developing schizophrenia. And finally, I developed more knowledge on the role of neurotransmitters in mental health disorders. I now understand that for depression, norepinephrine, serotonin, and dopamine are all typically low. However, anxiety and panic disorders do not involve dopamine, but instead involve GABA, norepinephrine, and serotonin. This was something interesting to me because GABA is the neurotransmitter that is affected by most anti-anxiety medications that I commonly administer to my patients. Since GABA is an inhibitory neurotransmitter, this makes sense because it typically causes my patients to become drowsy after taking it. And then what I have learned regarding substance use disorders. So while I knew that stimulant drugs could affect the heart, I was unaware of to what extent. I learned that cocaine and amphetamines, which are very commonly taken by adolescents, can even cause heart attacks, strokes, and early heart failure. I was also not aware of to what extent hallucinogenics and psychedelics could have on the body. I never knew they could increase one's body temperature, leading to dehydration and electrolyte imbalances. This would be something very useful to know if working in an emergency department, for example, and or if the patient was unable to tell you what drug is in their system. This way, a complete metabolic panel or a chemistry panel could be collected to determine if any electrolyte abnormalities were present. And finally, along with the dangers of alcohol withdrawal, I also learned that chronic alcoholism could lead to nerve damage due to malnutrition and neurotoxicity. This is another important factor to assess in a patient that you are worried about with alcoholism. So what I've learned and how that can how I can implement that into my future practice as a pediatric nurse practitioner. Going forward, when I become a PNP, I will definitely be mindful of what I have witnessed firsthand at the bedside, especially over these last 6 months, and also what I have seen as a result of social isolation relating to the pandemic. I will therefore always address the social supports of all of my patients of every age group. I will use my knowledge of signs of depression to effectively evaluate each of my pediatric patients. Oftentimes, they present to my pediatric medical surgical floor after a suicide attempt without ever being diagnosed with depression. Recognizing these signs and symptoms early can result in appropriate interventions before it's too late. I will also be very mindful of what I've learned in this course regarding recognizing behavioral changes in someone who has substance use disorder. This may include changes with their personality, changes in their performance, or their interest in work, school, or sports, an increase in risk-taking behaviors, or a change in their friend group. These are all things that I assess when I admit a patient to my pediatric medical surgical floor and something that I will pay close attention to in the outpatient setting. Thank you for listening.